Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's daily bulletin. Referring to the mandatory submission of an eligibility certificate to appear in the NAT board conducted screening test, the NMC has invited applications from the FMGE June 2023 candidates. The notification to this effect issued under the authority of Dr. Vijay Lakshmi, member of the Ethics and Medical Board of the NMC, calls for applications from FMGE aspirants seeking eligibility certificates for the forthcoming session and has specified the deadline for the same. A 30-year-old woman has developed vision impairment due to long-term use of smartphones. In a series of tweets, a Hyderabad-based doctor shared a case study of his patient and explained how the smartphone vision syndrome is caused and how she corrected her vision. Patient was claimed to have been using smartphones for several hours, including over 2 hours at night, keeping lights inside her room switched off. Instead of prescribing medicines, the doctor counseled Manju and suggested minimizing the use of smartphones. The doctor said Manju was anxious as she feared something sinister with her brain nerves but was finally determined to take corrective action. She said that instead of minimizing, I will stop looking at smartphone screen unless absolutely necessary. In any case, my phone use is recreational. Manju vision was restored after a month of corrective action, including her momentary loss of vision at night. The doctor further suggested to take a 20-second break after every 20-minute use of digital devices. Providing relief to 5 doctors who had attended COVID-19 patients during their super speciality course study, the Madras High Court bench has held that the COVID-19 service should be counted as their compulsory bond period, which they had been required to undergo compulsory government service after completing their course. Holding that the refusal by the government authorities cannot withstand judicial scrutiny, the High Court bench opined that it would also be discriminatory as against the petitioners herein when they are compared with other medical professionals who are actually completed their postgraduate study as the petitioners. According to some recent estimates, every year almost 80,000 women develop cervical cancer and 35,000 die due to it in India. The Serum Institute's Made in India vaccine against cervical cancer, Cervavac, will be available in the market this month at an MRP of ₹2,000 per vial of 2 doses. The first indigenous human papillomavirus vaccine was launched by Union Home Minister Amit Shah on 24th of January in the presence of Serum Institute of India CEO and its Director of Government and Regulatory Affairs Prakash Kumar Singh. According to unofficial sources, Mr. Singh has written a letter to Union Health Ministry mentioning that the price of its HPV vaccine for the private market will be ₹2,000 per vial of 2 doses, which is much lower than other available HPV vaccines. With hospitals, doctors and associations approaching the firm seeking its HPV vaccine, the Serum Institute is ready to roll out Cervavac in the private market from this month.
An international team of researchers show that caloric restriction can slow the pace of aging in healthy adults. The calorie intervention slowed pace of aging measured from participants' blood DNA methylation using the algorithm Dunedin pace. The intervention effect on Dunedin pace represented a 2 to 3% slowing in the pace of aging, which in other studies translates to a 10 to 15% reduction in mortality risk and effects similar to a smoking cessation intervention. The Calorie Phase 2 trial randomized 220 healthy men and women at 3 sites in the US to a 25% calorie restriction or normal diet for 2 years. Calorie is an acronym for Comprehensive Assessment of Long-Term Effects of Reducing Intake of Energy. In a new article published in Nature Medicine, the researchers shared results from a Phase 2 clinical trial of the oncolytic virus Thalassemogene Leher-Pervec combined with standard chemotherapy in patients with early-stage triple-negative breast cancer. Thalassemogene Leher-Pervec, or TVEC, is a modified herpes simplex 1 virus that includes coding sequences for the protein GM-CSF, which can stimulate the immune system. It is injected directly into the tumor and undergoes replication within the tumor cells, resulting in the breakdown of the tumor cell and production of tumor-derived antigens. Immune cells can recognize the antigens, infiltrate the tumor, and target the cancer cells for destruction. In addition, GM-CSF made by the virus acts as a beacon to help recruit immune cells to the tumor. A new study has examined the expression of thousands of genes in stem cell-generated motor neurons that are known to die in patients with amyotrophic lateral sclerosis, a fatal neurological disorder known as ALS or Lou Gehrig's disease. The study, published in the peer-reviewed journal Neuron, revealed sex was one of the main drivers of different gene expression in motor neurons, regardless of whether they were from patients diagnosed with ALS. The data is generated from patient stem cells that are then turned into motor neurons, the nerve cells responsible for muscle function. These motor neurons give researchers a better understanding of the mechanisms of the fatal disease and can potentially help lead to the development of new therapeutics that target specific cells and pathways. WHO has identified reducing maternal deaths, including death from sepsis, as a top global health priority. In a new study, researchers will unveil findings that suggest that a single dose of azithromycin given to women planning a vaginal delivery significantly reduced the risk of maternal death or sepsis. The randomized controlled trial included 29,278 participants who were randomized to receive either azithromycin, a popular low-cost antibiotic used to treat a wide variety of bacterial infections and is on the WHO's list of essential medicines, or a placebo. All participants were at least 28 weeks pregnant with a planned vaginal delivery at a healthcare facility. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.